Welcome back to my YouTube channel Health Matters with Dr. Shritama Banerjee. Today I shall be talking to you regarding potassium. Potassium is one of the most important ions of the human body. So coming to the important facts, the normal level of serum potassium, that is the normal level of potassium in the blood, is 3.5 to 5 milliequivalent per liter, or 3.5 to 5 millimoles per liter of blood. So then coming to what will happen if there is high potassium level in the blood. Precisely, if the level of potassium in the blood exceeds 5 to 5.5 milliequivalent per liter in blood, it will lead to a condition known as arrhythmia. What is arrhythmia? It is a disorder of the rhythm of the heart. That is, it might lead to conditions like bradycardia. That is, the heartbeat will decrease. The number of heartbeats per minute will become less. So, this is an important defect of excess potassium in the blood. Now, coming to which foods are high in potassium, and therefore to prevent arrhythmia, which foods you have to avoid in case you have a normally raised potassium level in the blood. For example, the normal level of potassium in the serum or the blood should be 3.5 to 5. Say if your normal level of potassium in the body is something around 4.5, something near to 5 normally. So in that case, there are certain food items which you need to avoid. For example, banana is a very important source of potassium. So it's very high in potassium. So you must avoid banana if you are prone to hyperkalemia or high potassium level in the blood. Then citrus fruits, for example, oranges. These are very high in potassium. Dry fruits like nuts, raisins, these are high in potassium. Then coconut water is a very high source of potassium. So all these things you need to avoid in case you are high in potassium already. Then coming to the vegetables, potato, sweet potato, these are very important sources of potassium. Tomato, this is a very high source of potassium. Then spinach, it's a very high source of potassium, along with lentils, pulses, dal, these are very high sources of potassium. And also you have to remember that dairy products, for example milk, yogurt, curd, cheese, these are very high sources of potassium as well. So you have to keep these in mind, that if you are prone to hyperkalemia, that is your potassium level in the blood is in the normal range but it is nearer to the higher value, that is it is nearer to 5, then you must avoid these foods, or you must keep these food quantities intake to a very low quantity to avoid disorders of the heart like arrhythmia. So arrhythmia can lead to life-threatening conditions. Hyperkalemia generally predisposes to bradycardia, that is lower heart rate. And also hyperkalemia is one condition which leads to damage of the kidney. That is, if normally your kidney function is all right, if it's doing good, then it's not a problem. But if your kidneys are not working well, then they will not be able to excrete the excess potassium out of the body. So that will again lead to hyperkalemia, which can again predispose to arrhythmia, bradycardia, and so on and so forth. So if your kidneys are working normally, they will excrete potassium properly. But if your kidneys are damaged, if you're a patient of chronic kidney disease or CKD, then you must limit or decrease your intake of potassium to avoid hyperkalemia. And also this summarizes the entire whatever I had to say about potassium. So potassium is a very important constituent of our food, of our diet, but since the normal range of potassium is very low, I would say it's a very small range. It's only 3.5 to 5 milli equivalent per liter, which is the normal range of potassium in the serum. Therefore, we have to be very careful and we have to keep monitoring our serum potassium levels frequently. So that was all I had to say. Have a good time. Stay happy. Stay healthy. Meet you again on my next video. Till then, bye bye.